Hello friends, top 5 warning signals in your pregnancy. As you all know that a pregnancy normally consists of 40 weeks duration. Let's divide this pregnancy into two halves. First 20 weeks and second half in the another 20 weeks, that is after 20 weeks up to 40 weeks. So I'm going to tell you top 5 warning signals in your pregnancy in the first half and in the second half. Well, let's start with the first half. So first and foremost warning signal or the danger sign in the pregnancy first half is bleeding per vaginum. Any kind of bleeding is abnormal in pregnancy. A very small amount of bleeding, whether it is brown or black or reddish or pinkish in color, can be normal, but it can be abnormal also. If the bleeding is heavy in amount, then it is definitely abnormal and you have to go and get yourself checked because it can be a sign of impending or threatened abortion. Second danger signal is pain in your lower half of tummy, that is cramping pain in the abdomen just below the navel. That is where your baby is during the first half of pregnancy, that is below the navel in the lower half of your abdomen. If you have severe pain, a cramping pain in that part, you should go and get yourself checked because that could also be a sign of threatened abortion. Third danger signal in pregnancy is any episode of fits or seizures or fainting attack during pregnancy. That could be serious, it could be life-threatening, it could be a symptom of miscarriage or an ectopic pregnancy or epilepsy, and you should go and get yourself checked. The next fourth warning signal in the first half of pregnancy is excessive amount of vomiting or loose stools. Well, you all know that some amount of vomiting is normal and it's a good sign for pregnancy. But if this vomiting is excessive, that is, you're not able to tolerate any kind of food or liquid or water or even water, anything you take comes out as vomiting, this may cause serious electrolyte disturbance in your body and serious dehydration. Similarly, if you have taken some wrong unhygienic food and that resulted in your gastroenteritis and loose stools, even that can cause electrolyte imbalance in your body and some vitamin deficiencies. So you should go to the doctor and consult immediately. And last danger sign in the first half is any type of fever with rashes all over your body. These type of fever with rashes, red spots on your body could be a sign of viral infection. There are few viruses that affect the baby growing inside you. So you should go to the doctor, get yourself checked and ask her what precautions you can take to avoid any damage. So now friends, if you have crossed 20 weeks of pregnancy, your second half has started. Till now, you must have started feeling baby movements. The first feeling of baby movements inside your tummy is known as quickening. After you have started feeling the movements, you have recognized how and what type of feeling do you have, then you try to feel it daily. The baby movements happen daily inside your tummy. Initial phase after 20 weeks, they may be very less in frequency, they may be only once or twice in a day. But as your pregnancy grows, gradually they increase. The feeling and the frequency of movements, baby kicks increase. It may increase to up to 10 to 20 times in a day. So the first danger signal in the second half of pregnancy is feeling less fetal kicks as compared to before. If you are feeling normal kicks, normal amount of kicks till now, and suddenly you start feeling less movements and you feel that your baby is a little lazy, it's a little inactive, then you should go to the doctor and get the baby's heartbeat and movements checked. Second, and the foremost danger signal in the second half of pregnancy is all the symptoms related to high blood pressure. What can be those symptoms? It could be headache, it could be a persistent vomiting, it could be pain in the upper half of the tummy, that is in the epigastrium region. It could be a blurred vision. It could be swelling in the feet, or it can also be a decreased urinary output. So all these symptoms combine together and they show that you might be having a problem which is called as preeclampsia. This usually happens in the first pregnancy and that too after 20 weeks, that is in the second half of pregnancy. So if you are noticing all these things and swelling of feet, then you should go to the doctor and get yourself checked, your BP checked, your urine checked, your blood test checked, and the doctor will tell you and give you the medicines for that. Now the third danger signal. Third danger signal which can happen in the later half of pregnancy is severe itching on your body, especially at night, and more on your legs and your feet. As you all know that some amount of itching on your tummy is normal in pregnancy, and that happens because your skin is stretching and you may have stretch marks for that. But if the itching is very severe, especially on the legs, then you have to go to the doctor and get your blood test checked for liver enzymes, because that may be a sign of cholestasis, and this problem can have side effects on your baby and yourself too. Now the next fourth danger signal in pregnancy is watery discharge from your vagina, or you can say a leakage of a gush of water which is very thin, almost like water or almost like urine, which can be a sign of rupturing the water bag of your baby. If this happens, you have to rush to the doctor because you may land up in a labor. And the last warning signal, which I told you in the first case, in the first part, is again bleeding PV. Bleeding PV usually doesn't happen in the second trimester, second half of pregnancy. If it is happening, even small in amount, this could be, the reason could be placenta which is low lying, or it could be premature separation of a little placenta, or it could be because of any cervical dilatation, that is, you might be going in labor. And if this is happening before 37 weeks, this is called preterm labor. This could be a sign of starting of labor. So if any amount of bleeding PV or a few drops you notice, you have to go to the doctor and get yourself checked. So friends, all these were the warning signs in your pregnancy. Keep a note of this video, and do take precautions, take good care, and go regularly to the doctor and get yourself checked. Thank you.